Someone who is in the need of cardiopulmonary resuscitation is in a very bad situation. Slide 1. Hollywood's portrayal of CPR is someone going unconscious and then a rescuer coming in and providing them chest compressions and quickly bringing them back to life. This is not quite accurate and is not always the outcome that is achieved. Today I'd like to go over the science behind CPR and what is actually occurring inside the body when we press on someone's chest and we blow in their mouths, what that's doing inside of our bodies. Many of us have been camping before and seen a hand water pump, one that requires you to pump up and down on the spigot to get water out of the ground. If you go over and pump on it just 1 or 2 times, you're not going to pull any water out of the ground. It requires several times pumping to get the pump primed to bring the water out of the ground. And the first little bit of water, because it's been stagnated down inside the pump, is going to be dirty. Similar to when someone goes unconscious, you have to pump on the chest or compress it several times to get that blood flowing effectively throughout the body to get the heart, or the organs and tissues to perfuse. Slide 2. I've been a firefighter for over 15 years and an EMT, and I've performed CPR on several different patients with varying outcomes. Wanting to improve my own skills and understanding of the CPR process, I've studied what's occurring inside the body extensively. I've also taught classes to various age groups and different levels of knowledge on the CPR process. Today I'm going to discuss the relationship between the heart and the lungs and how those work together to provide oxygenated blood throughout our body. First, I will discuss how the lungs exchange gases and provide fresh oxygen into the bloodstream. Second, I'll discuss how the heart pumps blood or pushes blood throughout the body and how that relates to chest compressions in the CPR process. Let's begin with the lungs. When we breathe in air, it requires us to breathe it in and get it deep down into our lungs. The lungs are shaped and built like an upside-down tree, with the main part of our airway up here being like a big, thick tree trunk that comes down into the bigger branches that branch off into the individual sides of the lung. Down inside the lungs is comprised of several smaller branches and twigs until we get down to the individual leaves. Those leaves are like our alveoli. In fact, we have over 300 leaves or alveoli inside of our lungs. It's at the alveoli level where we breathe in oxygen from the air. The alveoli exchange that oxygen with our bloodstream for carbon dioxide. That's a byproduct of our cells. Once this is exchanged, then the blood flow can go into the heart to be pumped through the body to perfuse everything. That's slide 3. When we do CPR, pressing on the chest cavity itself, it will compress the lungs a small bit and create a negative pressure and push air out of them. When we release on the chest, we're going to allow air to come into the lungs. This process is effective in exchanging air, but it's not super good. It is way more effective if we can pressurize air down into the lungs. This is achieved by what's known as mouth to mouth. Mouth to mouth, when we blow air into someone's lungs, we're attempting to get that air deep down into the alveoli. And because it's coming from our own lungs, it contains about 5% less air than the ambient air around us. The most effective way to accomplish this is by having an oxygen source that we can hook to the face with a mask and push that oxygen down into the lungs to give them the most oxygenated lungs for the alveoli to exchange into the gas or into the blood flow. If we can accomplish this at a rate of about 10 to 14 times a minute, we can effectively perfuse the body and get enough oxygenated blood to keep the body alive. If we go without oxygenated blood in our bodies for anywhere between 4 to 6 minutes, we begin to have irreversible damage. This can affect the brain primarily at first. The heart itself, if it's not perfused and oxygenated, can quit pumping. And anyone that has not had a good circulation or blood flow for over 10 minutes typically is not accessible, which means we're not going to bring them back to life. The heart and lungs work together in unison to provide this process throughout our body. So how does the heart, or when does someone need to be resuscitated? What causes this to happen? Well, in relationship to the lungs, if we cannot pull in oxygen into our lungs, either because it's been blocked, like when you choke and you block off your airway, you simply cannot get the air into the lungs. Another way this happens is if there's just not air around us to be brought into the lungs, similar to when we drowned. There's just not any air to be pulled in because we're submerged in water. The third way is that there can be a gas around us that's displacing the oxygen and simply not allowing us to breathe in oxygen because there's none in the air around us. It can also occur when the heart stops, and the heart can stop from a heart attack, which a heart attack is like a major interstate that all of a sudden stops traffic. An event becomes like a car wreck, it stops traffic, everything backs up and nothing moves. In a heart attack, when the heart stops pumping, the blood flow stops. It's just like backed up traffic on an interstate. Nobody's going anywhere. To correct these issues is why we do CPR. We either try to clear the airway and get fresh air and oxygen into the lungs, or we try and get the heart moving again to move blood throughout the body. The lack of oxygenated blood is a problem, and that's why we have to start to move that blood. So we start to compress on the chest. And compression of the chest is more than just pushing down. There's a large number of research that's been put into this by the American Heart Association, all the way from where we place our hands on the chest to how far down we press to making sure that we let the chest completely rise and recoil back. When you do chest compressions, the most effective way on an adult is to push the chest down 2 inches in depth. When we do this, we're going to damage the rib structure. Our ribs are meant to protect our internal organs, and by pushing down on them, we are adversely affecting what they're designed to do. But it's the only way that we can create pressure inside the chest cavity to get blood moving through the heart. So effective CPR, we're going to expect or anticipate that we're going to either crack or break someone's ribs. But if we don't, the chances of their survival are way down. Maintaining pressure on the chest is vital. We want to try and get a rhythm that is similar to our heartbeat. Our hearts beat roughly typically between 60 and 80 times a minute, but because we're not getting good oxygenated blood into the bloodstream, we want to try and increase that. So we want to compress the chest at a rate of 100 times a minute. A good way to accomplish this is to think of a song that has a rhythm that's about 100 beats a minute, and the most popular one is Staying Alive. If you can think of that song as you're compressing, you're going to accomplish that 100 beats a minute, and you're going to allow blood to get circulated through the body. Also, the chest recoil, or completely letting up on the chest, is vital, because that is the only time that we allow for that air exchange to occur and for fresh blood to come into the heart before we push it out again. So not only is it important that we go down, but we come all the way back up again. As you can imagine, doing this 100 times a minute becomes exhausting, so it is vital that we get as many people to help us as possible, and that we switch out those people doing those compressions to make sure we're getting the good depth and recoil at the same time. While compressions and rescue breathing is a good way to save a life, it's not nearly as effective as normal respirations and breathing. Matter of fact, the American Heart Association says it's only about 40 times or 40% as effective as normal breathing and blood circulation is. So today, I have expressed why we perform CPR, the reasons why we do it, and also what's occurring inside our bodies. We're getting fresh oxygen into the lungs to get exchanged with our blood flow, and we're pushing that blood flow through the body to hopefully help that patient the most effective way that we can. Secondly, I explained that those chest compressions are not only important because they help move air, but they also help move blood through the body and perfuse everything until we can get the heart restarted to beat on its own. So unlike Hollywood's portrayal of a rescuer coming in and saving their life in a matter of seconds, the reality is when someone is in need of CPR, it's a very serious situation, and very few survive that situation outside of a hospital setting.